I've worked every one of those hours.
My name is Carly Fox, and I'm staff emergency and critical care doctor here at the Animal Medical Center. I love my job very much. I'm very lucky to work in one of the busiest emergency rooms in the country. She's an older Pipple mix that came in for vaginal discharge. I'm going to check her for pyometra, where intact female dogs and cats can get an infection. Here's her abdomen, and these distended loops right here are actually her uterus. Everything else looks pretty normal, which is great. All right, we got the muzzle back on. She was good for it. I spend most of my time in the emergency room taking care of all emergent things, from like an ear infection, which owners find to be an emergent problem, to a cat that fell out of a 12-story window. He ate a biscotti 2 days ago, and the biscotti broke his jaw. Obviously, your jaw shouldn't break from eating a biscotti. This dog, who's a 15-year-old Yorkie, can imagine that he has very, very severe dental disease. I just love that I never know what's coming in the door next. This is a young dog that got into a bit of an altercation with a porcupine. These dogs need to be anesthetized. You're basically going on like a search for their quills. This is a 12-year-old cat. He has infectious discharges, and I'm gonna clip and flush this area. This is Gizmo. He's here because he woke up not using one of his hind legs. I'm gonna do an orthopedic exam and a physical exam and watch him walk and see what's going on. We see a lot of animals obviously in significant distress, and also with that their owners are in significant distress. Hey, how are you? It's Dr. Fox. So I just took a look at him. Of course, delivering bad news to people is difficult. As veterinarians, all veterinarians do it, but I think because I work in the emergency room, I probably do it more often.
Hello, I am doing some paperwork, as always, and I am eating dinner, and I'm calling a prescription in for a dog.
The emergency room has been extraordinarily busy throughout the pandemic, so our caseload has increased, I think, about like 30%. It's really high.
Good dog.
They're ready for that dog upstairs, Andrea.
I have come to work as scheduled this entire time. There's never been a day that I'm not at work because of the pandemic. We're all working. We're really, really proud that we can deliver them really excellent care very quickly.
It's 4 p.m. and you can see that our board is very full. 4 o'clock is also when new people come in for the 4 p.m. to midnight shift, so people are fresh and ready to go. I'm on my way to work, about to leave. This is what is happening.
I love that I can still do this job and have a family at home. I'm super lucky to be able to do that, especially at this level.
This is Hank. He is my first child. There he goes. Just giving him one more walk before I go to work. I try to get in some good quality Hank time.
I'm able on a lot of days to go and take my son to school and to do all those things that you should look forward to doing as a mom.
Mommy's going to work. I'll miss you. I'm gonna walk Hank first, but then I'm gonna go. Okay? That's fake.
I love walking in here and seeing the patients. Look at this guy.
This is a 1.5-year-old female, intact Frenchie. She had like 2 vomiting episodes. She hasn't really been eating very well. Her owners also noticed that her mammae were becoming a little bit more developed. If you look at the ultrasound, those are all uterine loops, and you can actually see little fetal sacs in there. She's gonna be a mommy. Spay and neuter your pets.
I've always wanted to be a veterinarian ever since I was little. If you look at my kindergarten yearbook where they ask you what you want to be under my name, it actually says veterinarian. It's a very wonderful profession in many ways. It's obviously very difficult in many ways as well, but I work with some of the smartest people I know, and I'm so lucky to call them my colleagues, but also call them my friends.
Wait, what is that? It's my box turtle.
Wait, oh my God, Tammy, it's yours? Oh my God. I was like, who brought that in like that? It's so cute.
Ooh. I've had her for 33 years.
We all work together as a team to help the patient always, and I think that's really our goal here. I truly learn something every day that I work. I've been doing this for a very long time, and I'm still learning, and I love that about this job, and I'm learning from the best people. I'm so lucky that my job is not just
being a veterinarian, but being a veterinarian at the Animal Medical Center.